Hi, my name is Jim Reynolds, and I am a volunteer at the Tech Museum in San Jose, California. At the Tech Museum, we have a space where we call it the Life Tech Encounter. At the Life Tech Encounter, we have examples of different types of implants that can be done in the human body, such as hip implant, knee implants, and now, thanks to SBI and Dr. Mann, we have a model of an ankle implant. And what people walk up to us and we explain to them these are the parts that are used in surgery, and they show a great deal of interest in, particularly if they're contemplating the surgery, to actually know what the parts are going to be used and what tools are going to be used and so forth. So we tell them that. It turns out I can speak with a particular passion about the ankle implant because I now have one of those in my ankle, thanks to Dr. Mann and SBI. It all began for me about 2 years, I'll say probably 07, 08 time frame, when my ankle became extremely painful. I could get up in the morning and walk for half a day, but after that it was just terribly painful and uncomfortable to walk on. And toward the middle of 09, it became so painful that I decided I had to do something about it. I went to a doctor and an orthopedic surgeon, and she suggested that I have the ankle fused. And since that was the only procedure that was offered, I went ahead and agreed to have that done. I was 2 weeks away from having that fusion done, and I heard from a friend of mine that she had a friend who had had an ankle replaced by Dr. Mann at the Oakland Bone and Joint place in Oakland. So I said to myself, let's check this out. So I went up and had an appointment with Dr. Mann, and he agreed that it was capable, it was suitable for replacement, and so we set an appointment to have that done. It was done in December of 09. I went into the hospital, was there for a very short period of time, about 2 days, during which the surgery took place. After the surgery, I was sent home in about 2 days' time with an anesthesia injection in the back of my knee, which apparently intercepted the pain coming from the sciatic nerve and made it comfortable for me to go home. I had that in there for about 3 days' time, and then after that, I was 2 weeks with my toes higher than my nose, and this was required by Dr. Mann, and that basically means you stay in bed all the time and move around on crutches when you have to. After that, I was about 2 more weeks with partial weight on the ankle, and after a total of 6 weeks, I could put full weight on the ankle and begin physical therapy to get the muscle strength back. It was really, for me, it was about another 6 weeks before I could really walk around without having any real pain in the ankle whatsoever. Since then, I've had great success. In the summer of 10, I actually climbed to the top of Vernal Falls at Yosemite National Park, and people who have done that know that you not only require some pretty good stamina, but you need a fine ankle to get up and down that hill. And I did that with great success. And also I was able to go skiing just last weekend here in March of 11. So I'm very satisfied with the ankle. It's fine to be able to do all these spectacular things like skiing and hiking, but I'll tell you the real relief is that I can get up in the morning and I can walk around that house without pain in my ankle. I would certainly recommend this procedure to anybody who has pain in their ankles and has trouble doing normal things. I find it's possible to walk up and down stairs, and this of course requires a great deal of ankle motion, both back and forth and twisting, and I have no trouble with that whatsoever. So I would recommend this surgery to anybody who has a lot of ankle pain.